Okay, so this week, the topic was really interesting to me because I think I've mentioned before, but I was recently diagnosed with PCOS, which follows like a metabolic syndrome and insulin resistance. Luckily, I don't have insulin resistance yet, but I've always struggled with my weight, even when exercising like I'm supposed to and eating like I'm supposed to. It just doesn't work as well for me as textbooks and a lot of doctors think that they should. So basically, I loved the speaker. I loved how he started out talking about how he tried to not pass judgment, but he did on that woman for just being fat and eating too much and not exercising, and then him developing metabolic syndrome after following the food pyramid and exercising. You know, I can relate because I feel that way all the time. It's something that really upsets me and bothers me. I liked how he said, who else have we failed? Because we've been so obsessed with the relationship of obesity causing insulin resistance versus insulin resistance causing obesity. I also liked how he mentioned 30 million people who are obese are not insulin resistant, and 6 million people who are lean are insulin resistant with a greater risk of other diseases than their obese counterparts. And that was 5 years ago. So I'm sure that those statistics have changed also. I really liked the bruise analogy he did also about treating the cause rather than the effect, and how he thinks it's backwards. As for current statistics that I found, basically some of them were from the CDC, some of them American Diabetic Association. There are 80 million Americans with insulin resistance, 100 million people with diabetes or prediabetes, and 15 to 30% of those with prediabetes will develop type 2 diabetes within 5 years. 12% of insulin-resistant people are currently thin. 90% of people who are obese have a dual diagnosis of type 2 diabetes. 160 million people in the U.S. are obese or overweight. 3/4 of those being men, 60% of them, or 3/4 of men and 60% of women. The extra glucose, soft drinks, candy, cakes, cookies, sweet treats, sweet cereals, grains, all these things that we have in our diet every day. As for stopping, we've got to figure out something. I really liked watching The Magic Pill on Netflix. It does really push the keto diet or like paleo eating, but it also has a lot of good information talking about how like sugar feeds disease, and it's true. And all of these statistics are showing that sugar feeds disease and carbs feed disease because this is what's happening to us. And I just hope that we figure something out.